What up, what up, what up, though? What up, what up, what up, though? What up, what up, what up, though? Hey, y'all, hey. Don't say we late, because we ain't. We on time, and we is, and we here. Hey, y'all, hey. What
Hey,
up,
hey,
though?
hey. What up, though?
Listen, we are here. Yes, I am here with the beautiful, beautiful Danita Davis, LPC. Y'all, give it up, y'all. Give it up to her. Listen, we are coming live to bring some healing to you guys today, and you might get some laughter because you know how I roll. And if you don't, you're going to learn today. Okay, but before I go on and tell you about Miss Beautiful Danita and Miss Beautiful Carolina, I'm going to tell you who I am. Are y'all ready? Y'all, I am Glendora Divine. I'm a licensed professional counselor. I'm board certified in mental health. And I am the best business coach to what? Us, licensed professional counselors and mental health professionals, period. Okay? Period. Stop playing. Don't be sleeping on, wake up. Stop playing. Okay? Listen, I love to try and be just the best that I can every day. So that's why today during this panel, when I was getting dressed, I was like, we're gonna put on the butterflies because I feel Muhammad coming out today. We're gonna fly like a butterfly and sting like a bee. Okay? Because I am super excited to it's May. It's Mental Health Awareness Month. And what we are doing is bringing you the awareness about body dysmorphia. Now, before I even get started, I want to give it up. If you are streaming in or looking in from Facebook, then you will see what we're talking about because it's going to be scribed. Okay, it's being scribed by Miss Beautiful Danita Moss. Y'all better get some Trinity Scribe in your life so people can really see what you're saying and get it. When you be dropping them nuggets, they can pick them up. Okay, pick them up. So that's what she is all about, and she is very beautiful and very helpful. So if you ever are doing anything live and you need anything, you need some help, please reach out to Trinity Scribes. So in the end, she's going to drop her information, but yeah, I gotta recognize because y'all gonna see, y'all gonna hear, y'all gonna learn, and y'all gonna still be able to pick up the nuggets when we drop them. When we drop them. Y'all, this is me all the time, and I'm super excited again that you all are here. All right, so let me tell y'all who here. Who here? Here, let me tell y'all. Y'all see him? Y'all see him? Y'all see him? Y'all, I got him on screen like, hey, we here, y'all. It is all right. So the way I see it on my screen, I see first, Miss Carolina. Miss Carlotta, I want you to come off mute, babe, and tell them who you are. Tell them who you are and what you do.
Hi, my name is Carolina Gilbert. I do individual counseling, group therapy, and I also take speaking engagements. My focus is what I am good at is anxiety, depression, trauma, providing cognitive behavioral therapy doing that, and I'm really happy to be here.
Yay. Okay, so then the next person I see is the beautiful Miss Danita. Miss Danita, would you come on and tell them, come off mic and mute and tell them who you are?
What up, though?
Yes, yes, y'all. Did y'all hear her? Did y'all hear her? Don't make me excited like that. But why she saying y'all? Why?
I am Danita Davis. I am a licensed mental health therapist and owner of DeKalb Wellness Solutions, which is a mental health and behavioral health agency. I am passionate about removing the stigma associated with mental wellness, particularly in the African American community. I offer individual sessions as well as psychoeducational workshops to dispel the myth as it relates to mental wellness. I address anxiety, depression, life transitions, self confidence, particularly for women and teens. I try to be as relatable and transparent as my approach as possible so that I can help you put the tools in your toolbox.
Yes, yes, yes. All right. Now I have another queen. Yes, I'm telling you, makes me super excited. I'm telling you, so beautiful. Miss Dr. Tanya.
Hello, how are you? Well, my name is Dr. Tanya Castor. I'm a doctorate's prepared, board certified psychiatric mental health nurse practitioner. I diagnose, evaluate, and treat those with psychiatric and mental health disorders. I specialize in ages 13 to 85, and I my expertise is cognitive behavioral therapy, along with medication management. I am a strong believer in not just motivating a particular gender or age, but motivating and uplifting people. I'm very passionate about imparting understanding of the human strengths, positive emotions, and distressing tolerance, building self-esteem, and I use cognitive strategies to assist others to basically clear their path to success and mental wellness. I'm also the founder of Clear Path Wellness Lounge. It's a mental health med spa in a sense. So I offer complementary treatments in addition to psychotropic medications such as IV therapy and hormone replacement therapy, which also at times contribute to depression and anxiety. So those are the clients that I usually see as those who have a diagnosis of depression, anxiety, and attention deficit disorder.
Let me tell y'all are, listen, this is why I do this, because I want you guys to understand that it is so many mental health professionals out there that look just like you, and we're ready. So Danita didn't say, but she said what up though, because she is from Detroit too. Come through, come through. I gotta put that out there. Okay, I gotta put that. But these beautiful ladies, with no further ado, we're gonna go ahead and get started. I'm gonna go ahead and let some of the ladies go to the background, and we're gonna keep the beautiful Dr. Castor. Okay. And let me tell you, Clear Path Wellness. Okay. Clear Path Wellness. If you don't know it, you're about to get to know it. Okay. You're going to hear a lot more about it. Okay. She said med spa. Okay.
Yes.
Listen, we're literally trying to let you know that we are out here. We look like you. We're ready to start this and healing process to happen. The healing process, along with laughter. Okay, along
Correct.
with laughter, because it's all about us actually healing. All right, and that's one of the best medications of them all.
Oh,
I
yeah,
truly do believe. Okay, and she do too. Okay, you see how we doing
I
this.
do.
But today we're here to talk about body dysmorphia. Body dysmorphia. And so, with no further ado, Dr. Tanya, what is that? Please come on, educate us a little bit. What is
All right. So, body dysmorphia is pretty much it's a mental illness that involves obsessive thoughts about flaws in your appearance. And what I mean by flaws, well, pretty much things that you perceive as something that's distasteful that you don't like about yourself. For example, my nose is too big, or my are too small or too big, or my forehead is too big or too small. It's pretty much a flaw that can be perceived as minor, something that other people can't see about you, but you particularly see about yourself. It involves obsessive thoughts at times. It involves individuals constantly checking in the mirror, constantly picking at themselves, constantly looking for ways to improve that particular area that they're feeling insecure about. It can also be perceived by others, individuals who don't know what body dysmorphic disorder is, also known as BDD. They can also perceive it as being insecure. Well, it's not. It's more than being insecure, because it is considered a mental disorder, and so I'll give you some examples, because I believe in the minority community. It's something that is oftentimes overlooked or unaddressed, and I believe it's because there is a knowledge deficit when it comes to body dysmorphic disorder, because we refer to it as low self-esteem or insecurities. There is a crisis, the minority community, African American community. We're seeing more and more individuals who are obsessing about plastic surgery. Now, one would say, well, if you want to fix something about yourself, yeah, you just have plastic surgery, but it's more than that. It's those individuals who are going back and getting procedures on one particular area of their body, and they've gone to multiple surgeons multiple times, and they're still dissatisfied. And the reason for their dissatisfaction is because it is a mental illness. It's something that they are obsessed about. It's something that usually they can't help unless they seek treatment by a professional who specializes in body dysmorphic disorder. It can also mimic obsessive compulsive disorder, also known as OCD. So it doesn't have a particular area of your body. It could be anywhere in your body. It could be your stomach, it could be your face, it could be a part of your face, it can be your butt, it could be your legs, it could be any particular thing. It doesn't have to be one particular area. So pretty much to sum it up, that's what body dysmorphic disorder is. It's just an obsessive thought of a particular area of your body that you're obsessed with that usually most people can't see.
Well, you know what? I was thinking about that when you said it's excessive thoughts. The first thing I was thinking too was OCD. So do you think that a lot of people actually misdiagnose people with OCD instead of body dysmorphia?
Correct. So to properly, and that's why it's important to do your research. It's important for you to educate yourself too, because although you seek assistance from a professional and you're hoping that they're versed enough or they're educated enough or they're skilled enough in the subject matter, you want to also do your own research to make sure that it's a fit, because oftentimes with these providers, depending on where you go and what their population is or who their population is, it can be difficult to misdiagnose. That's why it's important for you to do a thorough evaluation, to ask questions, because for example, I'm one of those providers that ask questions in many different ways, because I find that when you ask the same question in many different ways, oftentimes you'll get different responses. And I want to make sure that I usually break things down in the easiest terms. No matter what your degree is, no matter who you are, I want to break things down, because I don't ever want to assume that you understand because, let's say, you're a health professional or you're educated. So I believe that it's oftentimes misdiagnosed because there are so many similarities with obsessive compulsive disorder.
What about, is it like misdiagnosed in the community, that's like for the professional? So the community, when you said insecure, that the misdiagnosis that we take in the community when we're talking to our friends and family, and not really taking it as it's really truly a mental health issue?
Yes, it is, because already we're dealing with the there's already that perception that, oh, I'm Black, I don't have issues like that. I can't go through. Girl, that's a white person's issue, or that's like a whoever person's issue. And that's the mindset that a lot of people in our community has. So of course things are overlooked, because the last thing that you're going to think about is BDD, like in a Black person. Tammy Roman recently did an interview, and she did discuss that, and she disclosed that she does suffer from BDD, and she's been suffering from it for a long time. And when people were making comments when she lost a significant amount of weight recently, people were like, she's on crack, she's a crackhead, what's going on? And what she said was, when people say that, it satisfies her. It's like, okay, yes, good, I look good. Because she's like, she said oftentimes people think when they call me a crackhead, or if they say I look like a crackhead or I look like a bobblehead, that it's an insult. But for me, it's the biggest compliment.
Okay.
So that was surprising to a lot of people.
Yeah.
When she said that, because you're thinking Tammy Roman, she's successful, she's a celebrity, like what? But this is something that she's actually suffered with for over 20 years.
Yeah, and I think the other part that would be surprising is that, she will say it's a compliment, but that is actually why it's a disorder.
Correct.
Yeah.
Correct.
Yeah.
Correct.
What? We're going to get into like how to treat it. So, I'm going to take you off screen, but don't disappear.
I won't.
Because I really would like for you to come back. Thank you so much.
Thank you.
Y'all, again, Dr. Tanya.
Thank
All
you.
right, hold on for a second. Come on, let's talk about how to treat it. Let's talk about how to treat it with Miss Carolina, please come on and talk to us. Oh, good. Come off mute, huh? I think you're on mute. And I'm going to go on to the back.
All right. Sorry about that. Hi. So, yes, BDD, body dysmorphic disorder. So, how do you treat it? Usually, the best way to treat it is with talk therapy and in conjunction with medication can be real beneficial to treatment. So, with talk therapy, the best one that works is cognitive behavioral therapy. Why? Because it works with different treatment methods and behavior strategies. Because with body dysmorphic disorder, you have someone that has some distortions in their head. So we have to change that behavior, change that way of thinking so that they can replace it with more positive and less maladaptive way of thinking so that they can overcome this disorder. So the reason why cognitive behavioral therapy is beneficial, and sometimes you'll hear it be called CBT, is because it helps you learn how to change your negative thoughts and emotional reactions to more positive and more flexible ways of thinking. So, not being so rigid with your thinking, like, oh, I have to look this way in order to be accepted or to accept my body or to feel like I look normal. It allows you to replace it with more flexible ways of thinking to say, like, hey, people have curves, people have roles, people have different things going on, and that's okay. You learn how to maintain those negative thoughts and emotional reactions and behaviors over time. So it isn't just a one-time thing like, oh, I'm having a good day. I appreciate the fact that I have this part of my body that I didn't normally like. With ongoing cognitive behavioral therapy, you're able to gain the skills and the tools necessary to keep challenging those thoughts over time. You learn alternative ways to deal with your urges or rituals. So that helps reduce like mirror checking. A lot of people who deal with this are always looking in the mirror, looking for things that are wrong with their bodies. They're less likely with cognitive behavioral therapy to seek reassurance or get excessive use of medical treatments, medical services like plastic surgery, and things of that sort. Cognitive behavioral therapy will teach a person dealing with this how to deal with those behaviors, how to gain other behaviors to help improve your mental health, such as avoiding social avoidance when you're not feeling or looking your best, and increasing your involvement with healthy supports and different activities. Another thing that was mentioned that can be beneficial is medication treatment. Depressants work really well for people dealing with body dysmorphic disorder. And this because the specific antidepressant is SSRIs, which are the selective serotonin reuptake inhibitors. And those really help deal with this disorder because it increases the serotonin in your body and in your brain. Increases the serotonin in your brain. So, and what does serotonin do? So, what serotonin does, it helps with learning, memory, happiness, and regulating different things in your body. So when we use these antidepressants with someone with this disorder, it helps increase the serotonin in your body, which helps carry all those signals to your brain to make you not so depressed when looking at your body, not so anxious when there are some things about your body that you can't change. And it helps in conjunction with the cognitive behavioral therapy because now your brain and your emotions are in a better position to receive the treatment, apply them so they become a habit, and it's something that you can do ongoing so that you can overcome and manage the behaviors associated with body dysmorphic disorder. The best way to prevent this from becoming a serious problem is to catch it early. So if you have a child or a teenager, catch it early. If they seem overly concerned about their appearance or need reassurance, that's when you need to get into treatment before it becomes something big. Seek out a healthcare provider, their pediatrician, your doctor, or a mental health professional. That is the best way, is to catch it early. When we all have issues with self-esteem in our body. So if you find it's becoming something more serious, something someone is very preoccupied upon, get help early. the worst thing you could do is do those body enhancements. I think of who's in the news big today is Black China, who took out all her enhancements and feels better about herself because ultimately she probably did a lot of things to help change the way she viewed her body image and how she wants to be seen in the world. So it's really big that you get help early and realize that therapy can help you sort out your thoughts, gain new behaviors, and medication can help your brain be more receptive to treatment if you need that additional support, and help you meet your goal of having more sustainable self-esteem and view and outlook on your life. So remember, wellness and happiness has many paths. Find your ways to be well.
Yes, 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 yes. I was thinking about like it's really amazing to see these celebrities coming out and they're being their true authentic selves, from Tammy Roman to talk about having body dysmorphia to Angela and I think Michelle K. I think as I say it's Michelle K. She took out hers as well. But when you talk about the talk therapy, and it's so when we go see a therapist, if somebody is feeling like they are going through this and they're not just feeling insecure, but it's more than that, they should see a therapist that specializes in what again?
Cognitive behavioral therapy.
What if there's something else? What if they don't really practice cognitive behavior therapy? Or I really like the fact, honestly, you guys, if y'all go back and y'all watch this or just look at the comments that have been typing, if you go see a therapist that specializes in cognitive behavior therapy, talk therapy, we just gave you, or Carolina just gave you so many examples of what that therapist should be doing with you when you go in and see them. And I think that right there is what I was wanting to reiterate again, because I know she gave you what to look for. And not just when you go see a therapist and she say, or he say, oh yeah, I do CBT, I do cognitive behavior therapy. But also when you start to go into those sessions, are they doing some of these things that Carolina just said? Carolina, just say two things that they should look forward to if they're going to try this treatment with body dysmorphia.
What you're going to do is you're going to have to talk to someone that's going to give you tools to help change those negative thoughts and outlook on yourself. So you want to get someone that's going to help you challenge your thoughts and help you change them to more flexible ones. You're also going to learn ways to resist the urges that you have. So like look in the mirror. Sometimes body dysmorphia can turn into, eating disorder. So watch out, people who are going to help you challenge those negative behaviors and help you replace them with more positive ones.
So I guess I was picking up too is like when you say talk therapy, it's cognitive behavior therapy that's what we want them to do. But we want y'all to understand that you're not just going to go there and talk. You're going to be challenged and you're going to be pushed to actually try and do something different and come back and report that so you can try and heal. And that's what I believe we keep hearing. I thank you so much. And don't go far. We almost out of here, but don't you go far. Okay. Now we're going to go over, and thank you for those. And we're going to go over, I'm going to bring up, I'm going to take you down and we're going to bring up Miss Danita, because we just went over what is it, the treatment. And now let's talk about symptoms. What do it look like?
So what does it look like, you ask?
Yes.
So it's really with BDD, what it is that you're spending a lot of time scrutinizing your look, right? Your body image, you're comparing yourselves to other people. You're feeling extremely self-conscious and anxious about your appearance, right? Now, don't get me wrong. We all like a good selfie. We all like good angles. We all want the light to be in the right direction, but we don't want to find ourselves constantly checking our appearance and looking for minor imperfections or what I'll call defects in our own bodies, right? And another one of the symptoms is that you're engaging in repetitive behaviors and rituals. The young ladies, our other colleagues talked about this earlier, where you're doing excessive skin picking, or you are excessively grooming, and you're always in the mirror, and now you're starting to have anxiety about the way you look, and you're constantly worried and excessively thinking about what you look like. And then you want to seek cosmetic assistance, the BBLs, the implants. All of these things are perceived flaws that you may have in yourselves, and so now you're seeking medical or cosmetic support to change the way you look, right? So don't get me wrong, we all are concerned and have some insecurities, but if these insecurities are stopping you from living a day-to-day life, and you're not engaged in activities because you're concerned about how you look and how you feel, or you're not engaging in social interactions because of a perceived defect that you have, these are the symptoms that you want to challenge and seek professional help for. Like I said, we all have insecurities, but when we allow these insecurities to stifle us and not engage in social interactions, and we're constantly in the mirror and we're feeling embarrassed about how we look or how others may perceive us, those are warning signs. And that's when it's time for us to kind of tap into professional support, and to understand that it's okay to seek professional support for someone who's trained and licensed in these modalities and can help you change your thought processes, right? And so we just want to educate you on some of the things that are diagnostic symptoms. But if you or a child or someone that you're close to is experiencing, or you're noticing some of these things, these could potentially be symptoms and signs of an actual mental wellness or a mental health disorder that professional assistance can definitely alleviate and mitigate some of the things that we're going through in society. And with social media, we are seeing, because of the heightenedness in social media, we are seeing more and more BDDs in our offices, because everybody wants to have the perfect image. Everybody wants to have the perfect picture. Everybody wants to have the perfect angle. We're utilizing different filters in all of our images because we want the perfect look. And so we just want to be careful that when we are noticing these behaviors, that it doesn't produce any anxiety, and that it doesn't stifle us to the point to where we don't want to engage. So those are some of the symptoms that we've kind of reiterated on in our conversations today. So if you're feeling some of those things, I would encourage you to seek professional assistance. The ladies here are available, or reach out to someone within your state to get a consultation, because it's important that we address it head on and not allow it to continue to stifle us to where now we're not living our best lives, and we need the tools to put in our toolbox to help us overcome these symptoms.
Hey, listen, when you say stifle, let's get into it. What is stifle? When you say it's you don't want it to stifle you, like what would be that? How long would that be? If I wanted to go out for with my girlfriends, but then I was like, nothing is gonna fit right. Nothing is fitting right. Is that stifling me if I do it one time, or if what do you think?
If it becomes a repetitive behavior, right? So it has to be repetitive. It's not a one-off, right? Because there have been times where I've looked in my closet and I'm like, ain't nothing in there that I want to wear, right? Nothing is going to fit right. But if you're noticing that this is becoming a repetitive behavior, it's consistent. Every time somebody calls you and to go somewhere, and you're just, nothing is perfect, right? Those are the types of things that I'm talking about when I say stifle.
Okay.
It's not a one-off. It's consistent, consecutive, and repetitive.
Okay.
Those are things that we want to look out for.
All right. And another thing that you said that I wanted just for us to highlight, you said filters. Now, I know TikTok got a new filter, and you can look like, you look amazing. So when you starting to say, speak about the filters, Can you reiterate like how we have to be our true authentic selves and not get caught up on that's the only image that we want to put out there because or oh the AI images. Oh my God. Those okay, come on. Talk about because do you know because it might increase somebody's curiosity to do it like that,
Right.
do their AI image or use the TikTok filter. And then once they do, it's like, it start to consume them and, they don't want to post images no other way. So what do you want to say about this AI imagery and body dysmorphia disorder?
Okay. So you know what? I actually need to do an AI image because I want to see what the difference is, right? And so what's happening now with AI and the filters is that it's allowing us to not show up as our true authentic selves. And what we always want to do is show up being who we are, right? And then that's what when Carlotta was talking about the cognitive behavioral therapy and having the thought processes and changing the way we perceive ourselves. If I can look in the mirror in the morning and tell myself that I'm beautiful, then I won't need these filters to help me enhance what I already see when I look in the mirror at myself every morning. And so what's happening now with the AI is I can change my bone structure, right? And so if I'm getting caught up into the AI world, then when I show up, am I the AI person or am I Danita?
Right.
I want to own who I am and I want to get the tools that are necessary for me to show up and be authentic. I
You
want to
know
book
what? I'm
my
glad you said that part right there. I want to own who I am and show up as my true authentic self because the reality of it is that we haven't been able to show up and be visible in the first place. So here's just something else to keep us behind the scenes. We already been behind everybody else, so this is something else to throw another mask on us. So you guys be mindful when y'all are out here and generating these photos with AI and or playing with these filters. Make sure that what Danita said, that this feeling right here don't come over you. The feeling of embarrassment when you start to go around others and you worried about what others going to say when you do step in the room because you have been so AI or all filtered up and now you trying to live up to that image or you don't feel like you do. So just be mindful of that. I got to bring all the ladies back up right quick because we're going to go over these coping skills together. I think basically we all been hitting on these. Let me say something to the audience. Thank you guys for joining us. Thank you guys for watching us. And thank you guys for the hearts and the likes that you guys been giving us. We truly appreciate it. Mental health awareness is really something that's needed more than just the month of May. And if you know me, I'm always trying to advocate for it. So I really truly appreciate you guys showing up and watching us and hear what we have to say. And if you can share this out and tell somebody because we're serious about what we're talking about. We want to end the stigma related to mental health. So one of the coping skills that I believe everybody kind of said was seek professional help. Everybody, and I think when Dr. Tanya was talking about it, when we went a little bit deeper because we talked about, it's going to look like you're just being insecure, but the reality, what Danita just said, but when it's consistent, you're not, you know. Um, the next one that y'all all talked about it was, and I think um, Carolina spoke on it. She was speaking about challenging the negative thoughts. And one way to challenge negative thoughts, if you don't have a therapist and y'all agree or y'all disagree, is try and put the negative thought against something that's factual. Is that a practical way? Just put it up against something that's factual and then just evaluate to see if did you make it up yourself or is it a fact, right? Okay. What about and these are coping skills that Marquita was supposed to be with us, you all, but she is sick today, so she's not here. So she sent me over her work, and she was saying that just practice self-compassion if you have BDD. Y'all believe in that? What's give me something that you can do or say to practice self-compassion, one of y'all. Carol.
Um, Nobody's perfect. Like I feel like when we look at, just reminding yourself the people in magazines and on the media, they get filters, they get altered to those pictures and everything. We don't know what they look in the real life. So just appreciating how I look, because what I see on pictures in the magazines is generally not the real thing.
Right, right. All right. And another one was focus on other aspects of your life as a coping skill. So when she said that, she was talking about like your values. So I was thinking like, well, if you start to think about you don't like your nose or your nose is really big, then just think about, well, this nose was what I was using when I got that degree. Let me stop. Okay, so and then another aspect of your life might be a skill. Dr. You got a skill that they can focus on. They might be able to focus on. What is a skill?
Um, maybe. Well, I would say learning something new. Let's say if dancing was always your passion, but you got two left feet, take a
Right.
dancing class.
Yep. So
Um,
when you start thinking about, my hips too big, but you know what? I know I paid this money to go to this dancer class, so let me go and tip. Right.
Correct.
So
And burn some calories in the process, and you
see,
know.
there we go. All right, another one was talent, Danita. What's a talent? That instead of focusing on again my nose too big, and what is it gonna say when I walk in the room? What's a talent?
One of the things that we can do is accentuate the positive, right? If to take the focus off of my looks, if I know that I have a good sense of humor and my personality is an outstanding personality, I'm going to say something that's going to entertain you from the perspective or to help you keep your eyes off of what I perceive as my flaw.
That's right, because that was my next one was personality, and I had real fun. And I was thinking like, well, talent could be like if you sing, so maybe you could sing, And then the last one was traits. And again, we're not going to focus on the body, but we can say we got thick hair, you know, we got silky melon.
Or the ability to make people feel good. Some people have that trait.
Ooh, 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 ooh. See? And these are other coping skills, you guys, that you can focus on, or Tammy Roy can focus on when she go through, right? Here's a one, and I know you guys got something to say about this one. Another coping skill is avoiding comparing yourself to others, right?
Can you repeat what you just said?
Avoid comparing yourself to others.
Mm.
So,
Yeah.
and I think what we just went over, those other aspects that you got going on, is a great way to do that, right? Okay. They said engage in self care. I'm sorry, they was Marquita, but she said engage in self care, and she said make sure that it's something that is nostalgic that would bring you joy. So, what do you have to say about that? Somebody? All right.
Something that brings me joy.
Yeah. Do you think that's a good coping skill for body dysmorphia is to do something that actually brings you joy when you have the thoughts of what you are obsessing on? It's time to go do this thing that brings me joy.
Right? It's a good healthy distraction. So if hanging out with my family and my friends can distract me from having those perceived negative thoughts about myself, absolutely.
Okay, and I can say
Take
that
me
like
out
say
of
you're going through it and you're in your room and you're like starting to have those excessive thoughts, my thigh's too big. And so a good thing to do is just, what Danita's saying is get up and go in the room with your brother. Get up and go in the kitchen and where your mama cooking. Just you don't have to go in there and have the conversation, but you can just go in and be in their presence. What do you think, Carolina?
I think that's really good, because then you're, going with the cognitive behavioral therapy, then you're teaching your brain, saying, I don't have to get happy off of trying to alter or change my appearance in this moment and let myself get depressed. I can go do something that makes me happy and, satisfies that need that I have.
Yes, yes. All right. So the last one I think I'm gonna do is this one about being mindful. She didn't say being mindful. I wrote being mindful when I read it, but I love it. It's all about I am statements. I am statements. And I love it because I think when you say it, you honestly have to be mindful of what you're going to say next, that next word, because I feel like that's when you start declaring and decreeing, ugh, and you don't, and so it's never a joke, even though people want to make it a joke, whatever, but you got to challenge yourself not to make it a joke, not to declare and decree over you like that. So please, each one of you guys got something to say about sabotaging with yourself with these negative thoughts by not speaking affirmatively over yourself. And then we're going to go ahead and wrap it up.
I'd like to just kind of like add on to what you said and also add some different perspectives as well. It's, when you tell people to declare and decree is one thing, but in addition to declare and decreeing, it's important for you to also extract yourself from environments or from the company of people who basically talk down on you, who talk negative, because it's something that's very common in the minority community, African American, Afro Caribbean community, the down talking, the nitpicking about appearances, complexions, features, hair textures. So a lot of those things, if you're around people like that, it's important for you to kind of like extract yourself and surround yourself with more positive people. That's also going to help you that when you do decree and declare, it's one thing, but believing it, because I can say whatever, but actually believing it is something that's completely different. So it's important for you to change your environment to assess what is it in my circle, what is it in my environment that's contributing to these negative thoughts. One thing that I did want to say as well that I wanted to use as an example about BDD, body dysmorphic disorder, is that just because you don't like something about yourself doesn't necessarily mean that you suffer from body dysmorphic disorder. So for anyone looking or for anyone viewing, I want you to understand that there is a difference. I may not like the shape of my nose, but that doesn't necessarily mean that I have body dysmorphic disorder. I may choose to seek a consultation from a cosmetic surgeon or a plastic surgeon to get rhinoplasty, but it doesn't necessarily mean that I have body dysmorphic disorder. It just may mean that I may want to enhance my nose. But those are the things that I would encourage you to do, is to just kind of assess your environment, assess the entire situation, and surround yourself with people who are going to contribute to that positive thought, that are going to reinforce your decrees and your declarations on your life and about yourself.
Yes, ma'am. Yes, ma'am. Come on, Carolina.
Yes, she hit it on the nail. I was going to say the same thing. Surrounding yourself with people is important. Like I deal with clients a lot who even deal with depression, and you have to make sure you surround yourself with people who are going to affirm what you're trying to affirm within yourself. At the same time, you got to evaluate your circle, just as she said, to say, okay, who are the people that are continuing to keep me in this mindset of these negative thoughts that I'm having about my body and my body image. So you have to definitely evaluate your circle, because sometimes I'll say this all the time in therapy. Sometimes you can't believe the positive thoughts you're trying to have for yourself in the moment. You got to pull on the support and the strength of other people until you can believe it for yourself.
Correct.
So surrounding yourself with people is important when you're trying to decree and declare and affirm some things in your life. And also, even when it feels uncomfortable, still say those things, because it may feel uncomfortable right now and something that you feel is not a truth right now, but it can become your truth because you're seeking out treatment. You're realizing this is an issue. So keep saying it, keep affirming it, keep believing it. And as you continue to practice those skills and the tools that you receive in therapy, it will become your truth and you can better live it out.
Yes. All right, Danita, come on.
So listen, what can I add to all of this?
Girl, listen, because you know what? The last one on my thing was get a supportive environment. And listen, y'all just coming and bringing it. So come on with this. Come on, add on.
Yeah, the only other thing that I would add to what these ladies have already said is to begin to journal, right? If you can begin to journal and recognize when I'm feeling like this, or what's happening in my environment or in my life that's causing me to think like this will help us identify what your triggers are. And if we can begin to recognize what our triggers are, we can apply the appropriate coping skills. And so, what I would say to anybody that's dealing with or what may feel like body dysmorphic disorder is look in the mirror every morning and say that I am beautiful, flaws and all.
Yes.
Right? Because we
Yes.
all have them, and we just have to begin to embrace them and continue to put tools in our toolbox and make sure we're using the right tool when the right trigger comes along.
Oh, girl, yes. Listen, Dr. Tanya, let's go ahead and let them know because this is the resource part. You all did an amazing job, and I can't thank you enough for showing up and showing out like you did. So, listen, Dr. Tanya, please go ahead and give them your contact information and again, the Clear Path Wellness information again.
Okay, well, Clear Path Wellness Lounge is located in Hollandale Beach, Florida. That is right across the county line of Miami. I can be reached on Instagram at Clear Path Wellness Lounge. And also, my contact phone number is 754-294-HELP. That's 754-294-HELP.
Yes. Okay. Danita, come on and let us know how they can get in contact with you at DeKalb Solutions.
DeKalb Wellness Solutions is housed in Charlotte, North Carolina. My phone number is 704-956-9566. And although I'm in North Carolina, I also provide telemental health for residents in the state of Michigan. I'm also licensed in the state of Michigan. My email is info@DeKalbWellnessSolutions.com.
Yes. Yes. And did you give me your website address?
Website is www.dekalbsolutions.com.
Okay. And you guys, all of this is in the chat on a Facebook group. So you should be able to, a Facebook page or whatever, you should be able to find it and get this information again. You can always tag me on any of these platforms and I will be gladly to put you in contact with these women. Women. Come on, Carol. So I'm looking at you, girl, and I'm like, come on, Carol. I come Serenity. Come on.
So I am Serene Counseling and Wellness. I am located here in the state of Michigan. My Instagram is Serene Counseling and Wellness 21. You can reach me at 248-598-4969. And my website is www.serenecounselingandwellness.online. So I am accepting new clients. And I also have a journal that you can use on Amazon. It's called Free Your Mind. Look me up, Carolita Gilbert.
Carol, what is your LinkedIn?
My LinkedIn is my name, Carolita Gilbert.
I mean your link tree, babe. I meant to say link tree.
My link tree is /Serene Counseling. So link.tree /Serene Counseling.
Yes, and you can find her journal on there as well too.
Yes.
And y'all know I am Glendora Divine. And I am super excited that you guys tuned in and you came to listen about body dysmorphia. I want you guys to tune in with us all month long because we are going to continue to bring healing and laughter. I hope you can snuck in a couple of little laughters today, but we are greatly appreciative for you being here today and listening to us. Please share this out and tell somebody it's time to heal. Stay lifted. All right, y'all, let's go. Bye-bye.